Okay. Good evening, everyone. We are the group 4 and we are presenting about drugs acting on the upper respiratory system. So if we are talking about the respiratory system, this is the organs and other parts of our body involved in breathing when we exchange oxygen and carbon dioxide. The main function of the respiratory system is to move fresh air into our body while removing waste gases. There, There is a short review of respiratory system. This is the process of physiological respiration includes two major parts, which is the external respiration and internal respiration. If you are talking about external respiration, known as breathing, involves both bringing air into the lungs, which is the inhalation, and releasing air to the atmosphere, which is the exhalation. During the internal respiration, oxygen and carbon dioxide are exchanged between the cells and blood vessels. For the inhalation and exhalation, these are body our body brings in oxygen and gets rid of carbon dioxide. The process gets help from a large dome-shaped muscle under our lungs called the diaphragm. When we breathe in, our diaphragm pulls downward, creating a vacuum that causes a rush of air into our lungs. And the opposite happens with exhalation. Our diaphragm relaxes upward, pushing on our lungs, allowing them to deflate. The respiration begins at the nose or mouth, where oxygenated air is brought in before moving down the pharynx, the larynx, and the trachea. So the trachea branches into the bronchi, each leading into a lung. So each bronchus is divided into smaller bronchi and again into even smaller tubes, which is called the bronchioles. At the end of the bronchioles are air sacs called alveoli, and this is where gas exchange occurs. In our body, we have about 600 million of alveoli. These alveoli are surrounded by a mesh of tiny blood vessels called capillaries, which is the smallest and most numerous of the blood vessels. After absorbing oxygen, blood goes to our heart, and our heart then pumps it through our body to the cells of our tissues and organs. As the cells use oxygen, they make carbon dioxide that goes into our blood. Then our blood then carries the carbon dioxide back to your lungs where it's removed from your body when you exhale. Next slide, please. There is an important structure of respiration, which is the diaphragm. When the diaphragm contracts, it flattens the lungs, expand, drawing air into the lungs. When it relaxes, air flows out, allowing the lungs to deflate. Next slide, please. We will go now about upper respiratory drugs. These are the antitussives. A cough, also known as tissues, is a sudden reflex of humans and many animals have to clear the throat and breathing passage of foreign particles, microbes, irritants, fluids, and mucus. It is a rapid expulsion of air from the lungs. Next slide, please. There is a definition of antitussive. These are drugs that suppresses coughing, possibly by reducing the activity of the cough center in the brain. So in short po, ang antitussive is a cough suppressant and a medication that help relieve a cough. And they are typically used to treat dry cough caused by allergies, respiratory illnesses, and other infections. There are classification of coughs. We have the acute cough. This is a cough of sudden onset that lasts up to 3 weeks. Subacute cough. This type of cough persists for between 3 and 8 weeks. The chronic cough. This type persists for over 8 weeks. And nocturnal cough only occurs at night. Next slide, please. There are two basic type of coughs. We have the productive cough and the non-productive cough. If we are talking about productive cough, these removes excessive secretions, for example, our phlegms. And non-productive cough, this is the dry cough and it is harmful. There are cough receptors, which is the chemo and mechanoreceptors in mucosa of the bronchial tree from the nose to the distal bronchi. And it impulses from these receptors are transmitted through the vagus and glossopharyngeal nerves to the cough center in the medulla. If we're talking about the vagus, these are the nerve that is important branches in the neck, while the glossopharyngeal nerve, these provide sensation including stays to the posterior third of the tongue and also sensation to the back of the oral cavity and the oropharynx. That's it. Thank
So mechanism of cough production. The cough receptors lie in the mucosa of the bronchial tree, down to afferent impulses passes to the medulla, and then sequence of events is triggered by medulla oblongata and causing cough production. So these are the some antitussive drugs. The antitussives is first is the codeine, B is the hydrocodone, C noscapine, D dextromethorphan, E the diphenhydramine, and F is the benzonatate. Next, antitussive indication. So this is used to stop the cough. Reflects when the cough is non-productive example for the dry cough. So yung antitussive is ginagamit to prevent or relieve a cough. So the classification, the antitussive, the narcotic opioid antitussive, codeine, which the codeine is an opiate and prodrug of morphine. So opioid medications that used to treat mild to moderately severe pain. So next is the hydrocodone. It is used to treat pain and as a cough suppressant. So the non-narcotic, non-opioid antitussive is first is the dextromethorphan or used to treat cough and chest congestions caused by cold or allergies. Hindi niya nagagamot yung ubo na nanggaling sa paninigarilyo. I mean. Then next is the benzonatate or try to help with the symptoms of cough and high cough. So third is the diphenhydramine or antihistamines used to relieve symptoms of allergy, high fever, and common colds. Next po. So this is the mechanism of action. So the narcotic anti-T-tubes codeine and the hydrocodone suppress the cough reflex through a direct action on this cough center. So non-narcotic drugs suppress the cough reflex by anesthetizing or numbing the cough receptors in respiratory tract and thus keeping the cough reflex from being stimulated in the medulla. Next po. So, narcotic agents. So, the narcotic agents have anti-tissue effects. They are effective in suppressing the cough reflex. So, they are foam drugs. So, yung foam drugs is the prescriptions only medication. So, it means ito yung mga therapeutic product na that can only be obtained from a doctor, from pharmacies with a prescriptions from the doctor. So, their use lead dependence to the codeine and the hydrocodone. Non-narcotic agents naman is it is an anti-tussive drugs are less effective than the narcotic ones. They are available either alone or combinations with other agents that they are foam drugs. First is the dextromethorphan and the benzonatate. So the anti-tussive contraindications is the asthma. Second is the COPD or the chronic obstructive pulmonary disease. and third is the hypersensitivity, and fourth is the head injury. So there are side effects of antitussives with the dizziness, pananakit ng ulo, drowsiness, dry mouth, nausea, vomiting, and the constipation.
So here's an example of antitussive. So the drug name, Thessalon Pearls for the brand name. For the generic name is benzonatate. For its classification, benzonatate is in a class of medications called antitussives. So these are cough suppressants. It works by reducing the cough reflex in the lungs and air passages. Dose, route, and frequency. Dosage to relieve coughing. Adult dosage, ages 18 years and older. Should take 100 to 200 milligrams 3 times per day as needed for your cough. The maximum dosage is 600 milligrams per day. For the indication and contraindication. Contraindication, hypersensitivity to benzonatate or any related compounds is a contraindication to its administration. Indications. This medication is a non-narcotic cough suppressant prescribed for cough. For its mechanism of action, benzonatate is a local anesthetic drug that acts peripherally by anesthetizing and reducing the activity of vagal stretch receptors or nerve fibers located in the respiratory passages, lungs, and pleura. Adverse reactions: hypersensitivity reaction, bronchospasm, laryngospasm, cardiovascular collapse, possibly related to local anesthesia from chewing or sucking the capsule, or pearl chest numbness, chilly sensation, confusion, and constipation. For nursing considerations, history, allergy to benzonatate or related compounds, tetracycline, lactation, pregnancy. For the physical, nasal mucous membranes, skin color, lesions, orientation, affect adventitious sounds, interventions. Before learning about antihistamines, we must learn about histamine. So histamine is an organic nitrogen compound involved with our immune system. So histamine is usually our friend. It is a signaling molecule that sends message between cells. It tells stomach cells to make stomach acid, and it helps our brain to stay awake. Histamine also works with our immune system. Histamine's actions are great for protecting the body against parasites, but with allergies, the immune system overreacts to harmless substances, not with parasites. So it was discovered in 1910 by Henry Dale and Patrick Laidlaw. Histamine is released when someone has genetically induced allergic reaction and causes inflammatory responses. Second type of allergic histamine is one of the major causes of asthma. Histamine in the body. When someone has a reaction called allergens, a substance that triggers an allergic reaction, release large amount of histamine. So, this is when histamine becomes our foe o nagiging kaaway natin siya. So, the histamine will then attach to the receptors of nearby cells, which causes inflammatory responses such as runny nose and eyes, itchy eyes, nausea, swelling, sleep disorders, and stomach ulcers. So, brief history of antihistamine. A Swiss-Italian pharmacologist who lived from 1907 to 1992 named Daniel Boventel, a group that created the first antihistamines in 1937. Daniel Bovant, assisted by Anne-Marie Staub, studied the chemical process behind the antihistamine and would run tests on pigs. He won the 1957 Nobel Prize in Physiology or Medicine for work developing antihistamines. First use of antihistamines. Antihistamines were first used successfully to treat people in 1947. Bernard Halpern introduced one of the first products called Antergan. So, Antergan was yung mga unang product ng antihistamine. It was revised in 1944 and then introduced in the United States in 1946 as diphenhydramine and triphenyllamine. Antihistamines became all the rage by 1950 as the first classes of antihistamines were introduced, including ethylenediamine, ethanolamines, alkylamines, piperazine, and tricyclics. Antihistamine products. While capsules are the slowest method of gaining antihistamine relief, they can be long-lasting in their effects. Some may have the ability to work all day. Topical application of creams or ointments can bring almost immediate relief from some symptoms, but reapplication may be necessary. So wala namang overdose sa pag-apply ng creams, kaya okay lang na mag-apply if needed. After just a few hours, nasal sprays that contain an antihistamine can also bring almost immediate relief from a runny nose. Antihistamine containing eye drops can also be quick acting in their ability to quell itchy and watery eyes. Next reporter.
So let us move on to the synthesis of histamine. So histamine is a low molecular weight amine. Histamine is produced by various cells. Histamine regulation is dependent on the gene of HDC enzyme. Mast cells and basophils are the major source of granule-stored histamine. Myeloid and lymphoid cells types that do not store histamine show high HDC activity and are capable of production of high amounts of histamine. So there are types of allergies treated by histamine. They are the food allergies, pollen allergies, animal allergies, plant allergies, drug allergies, seasonal allergies, and the asthma. So mold and mildew allergies. Antihistamine in the media, common brand names are familiar to the most who watch television since they are always being advertised. So the popular brands are the Claritin, Zitrec, Vicin, Allegra, Benadryl allergy, and the Tylenol allergy. Other uses for antihistamine include treatment for stomach, ulcers, and acid reflux disease. An antihistamine is useful in this area because of it has the ability to decrease the production of gastric acid in our stomach. An antihistamine can also be effective in easing the local swelling such as that which occurs from a bee sting or insect bite. So there are the classes of first generation H1 receptor antagonist antihistamines. So they are the ethylenediamines, ethanolamines, alkalines, piperazines, and the tricyclics. Closing facts, antihistamines are found in prescription and non-prescription form. We do not build tolerance to antihistamines, so people can overdose on antihistamines. Majority of the time, it's not fatal, but you may need medical attention. Can become fatal if you overdose and the medicine reacts badly with another drug being taken. So, how are antihistamines classified? So, yung antihistamines are divided into two major subtypes. So, yung first subtype is tinatawag natin na yung H-1 receptor. antagonists or the H-1 blockers. This subtype of antihistamines ay ginagamit para i-treat yung mga allergy symptoms. So the second subtype is called the H-2 receptor antagonist or the H-2 blockers. Ito naman is ginagamit to treat gastrointestinal conditions including gastroesophageal reflux disease or the GERD and also called acid reflux, peptic ulcers, gastritis, motion sickness, nausea, and vomiting. The naming structure, which are the H-1 and the H-2, tells doctors and scientists the cell type, the location of the histamine receptor that the antihistamine medication blocks. So how do I know which antihistamine to take? Because there are so many antihistamine products, both over the counter and prescription, and because they are used to treat so many different conditions, you may need to help figuring out which medication to take. For minor ailments, you can probably take over the counter products. You can read the package labeling and match your symptoms to the labeled symptoms. Also, never hesitate to ask the pharmacist. They are highly schooled in the actions and side effects of drugs. You may need to try different antihistamines, but no more than one at a time use unless directed by your physician to find the best medication to manage your symptoms. If you need a prescription of antihistamine, you and your healthcare provider will work together to figure out what medication will be best for you. Many drugs interact with antihistamines, so your healthcare provider will want to know what medical conditions you have and medications you are currently taking. They will also want to know if you are pregnant, plan to become pregnant, or are breastfeeding. Some antihistamines are not recommended in pregnancy because they may cause birth defects in very high doses. Antihistamines can pass into breast milk, so you should consult with your healthcare provider before using antihistamines if you are breastfeeding. Children and the elderly are more sensitive to the effects of antihistamines, so special consideration will be given to the use of these products in these patients. Never give over-the-counter cough and cold antihistamines to children under 4 years. These medications can cause life-threatening side effects.
Drug name, chlorpheniramine. Brand name, chlortrimeton diabetic toxin. Generic name, chlorpheniramine. Classification, antihistamine. Dose route and frequency. Adults and children over 12 years, 4 milligram or 1 tablet or 10 ml liquid medicine every 4 to 6 hours. Do not take more than 6 doses or 24 milligram a day if you are under 65 years of age or more than a total of 3 doses. Indication and contraindication. Contraindication. Overactive thyroid gland, close angle glaucoma, high blood pressure, stenosing peptic ulcer, blockage of the stomach or intestine, blockage of the urinary bladder, and large. Mechanism of action. Chlorpheniramine binds to the histamine H1 receptor. This blocks the action of endogenous histamine, which subsequently leads to temporary relief of the negative symptoms brought on by histamine. Adverse reaction. Drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth and nose. Throat may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly to relieve dry mouth, suck, sugarless. Nursing considerations. Assessment history. Allergy to any antihistamines, narrow angle, glaucoma, stenosing peptic ulcer, symptomatic prostatic hypertrophy, asthmatic attack, bladder neck obstruction, pyloroduodenal obstruction, pregnancy, lactation, physical skin. So next, expectorant. These are the agents which enhance the secretion of sputum from trachea, bronchi, or lungs, and hence they are used in treatment of cough. Or they are also identified or defined as agent that facilitates the removal of bronchopulmonary mucus secretion membrane. Classification of expectorants. Based on MOA, they are categorized into two types. First is the sedative expectorant and second is the stimulant expectorants. Sedative expectorants. These are stomach irritant expectorants which are able to produce their effects through stimulation of gastric reflexes. For example, bitter drugs, IPECAC or Senega, Indian squill, inorganic compounds, antimony, potassium tartrate, ammonium chloride, sodium citrate, potassium iodide. Stimulant expectorants. These are the expectorants which bring about a stimulation of the secretory cells of the respiratory tract directly or indirectly. Since this drug stimulates secretion, more fluid in respiratory tract and sputum is diluted. For example, eucalyptus, lemon, and anise.
So let's move on the next slide. Drug name, guaifenesin. Generic name, guaifenesin. Brand name, Mucinex or Robitussin. Classification, expectorants. Dose, route, frequency, usual adult dose for cough, immediate release formulation, 200 to 400 milligram orally every 4 hours as needed, not to exceed 2.4 grams per day. Indication and contraindication. Contraindication, overactive thyroid gland, diabetes, closed-angle glaucoma, high blood pressure, significant uncontrolled high blood pressure, severe disease of the arteries of the heart. Mechanism of action, thought to act as an expectorant by increasing the volume and reducing the viscosity of secretions in the trachea and bronchi. It may aid in the flow of respiratory tract secretions, allowing ciliary. Adverse reaction, hives, difficulty in breathing, swelling of your face, lips, tongue or throat, dizziness, headache, drowsiness and rashes, or nausea and vomiting, and stomach upset. Assessment history, allergy in guaifenesin, persistent cough due to smoking, asthma or emphysema, very productive cough, and pregnancy. Physical, skin lesions, color, orientation, affect, adventitious sounds interventions. So decongestants, there are two dosage forms, which is oral and inhaled or topically applied to the nasal membranes. Next, nasal congestion, excessive nasal secretions. Next, inflamed and swollen nasal mucosa. Primary causes, these are allergies, upper respiratory infections like common colds. Decongestants, there are two main types. These are used adrenergics or largest group and corticosteroids. Next, topical nasal decongestants, adrenergics. These are the four: eperadrine, oxymetazoline, lefazoline, and phenylephrine. In intranasal steroids, beclomethasone or dipropionate and flunisolide. In oral decongestant, prolonged decongestant effects but delayed onset, effect less potent than topical. No rebound congestion, exclusively adrenergics, example, phenylephrine and pseudoephedrine. In topical nasal decongestants, both adrenergics and steroids, prompt onset, patent, sustained use over several days causes rebound congestion, making the condition worse. So let's move on. Sudafed. So the brand name of Sudafed is chlortrimeton nasal decongestant. So classification is decongestant. Route, dose, and frequency. Adults and children 12 years old and over. Take 1 tablet every 4 hours. Do not take more than 6 tablets in 24 hours. Children under 12 years old, as a doctor, use only as directed. Next, contraindication and indication. So indication, the most common indication for pseudoephedrine is as a decongestant for conditions including nasal congestion, sinus congestion, and eustachian tube congestion. Mechanism of action, a mixed mechanism of action, direct and indirect. It indirectly stimulates alpha adrenergic receptors, causing the release of endogenous norepinephrine from the granularity of neurons while it. So adverse reaction, fast pounding or uneven heartbeat, severe dizziness or anxiety, easy bruising or bleeding, unusual weakness, fever, chills, body aches, and flu symptoms or dangerously high. Nursing assessment, history taking, and examination of a client using decongestant should include the following: assess for possible cautions and contraindications, any history of allergy to the drug or a component. So mucolytics are a class of drug used to help break up and thin mucus, making it easier to clear from the airways. They are used to treat respiratory conditions such as COPD or the chronic obstructive pulmonary disease, cystic fibrosis, and other conditions including common colds marked by excess mucus and a productive cough. Type of mucoactive agents include expectorants, mucolytics, mucoregulators, and mucokinetics, and they are often taken orally or breathed in via a nebulizer. Mucolytics work best if taken consistently. Mucolytics can be taken orally in tablet or syrup formulation or inhaled through a nebulizer. Some of the common types of mucolytics include Mucinex or the guaifenesin, carbocisteine, pulmozyme, endorstine, mesistine, bromhexine, hyperosmolar saline, and mannitol powder. So classic mucolytics depolymerize the mucin glycoprotein oligomers by hydrolyzing the disulfide bonds that link the mucin monomers. This is usually accomplished by free thiol groups, which hydrolyze disulfide bonds attached to cysteine residues of the protein core. The best known of these agents in N-acetyl and L-cysteine. No data convincingly demonstrate that any classic mucolytic, including NAC, improves the ability to expectorate mucus. It is theoretically possible that NAC aerosol can increase the risk of airway infection and inflammation by disrupting the protective mucin layer. There are several similar compounds that contains sulfhydryl groups that can effectively So peptide mucolytics, the mucin polymer network is essential for normal mucus clearance. It may be the classic mucolytics are generally effective because they depolymerize essential components of the mucus gel. With, with airway inflammation and inflammatory cell necrosis, a secondary polymer network of DNA and F-actin develops in purulent secretions. So in contrast to the mucin network, this pathologic polymer gel serves no obvious purpose in airway protection or mucus clearance. In patients with stable CF, there is almost no mucin in airway secretions. And although mucin can be secreted in response to an exacerbation of disease, there is still much less mucin than DNA in the CF airway. So non-destructive mucolytics. Mucin is a polyionic tangled network, and the charged nature of the oligosaccharide side chains help to hold this network together as a gel. Several agents have been proposed that can loosen this network by charge shielding. These agents include low molecular weight dextran, heparin, and other sugars or glycoproteins. To date, there have been no reported clinical studies of these drugs for the therapy of airway disease. So, generic name, carbocysteine. Classification, mucolytic. Route, dose, and frequency. Dosage for adults, capsules to 375 milligram capsules taken 3 times a day. When your symptoms improve, your doctor may recommend 1 capsule taken 4 times a day. So contraindication, carbocysteine is indicated over the counter and in prescription formulas to clear airway secretion in condition associated with increased mucus. Mechanism of action. The hypersecretion of mucus characterizes serious respiratory conditions including asthma, cystic fibrosis, and chronic obstructive pulmonary disease. It blocks bacterial. Adverse reaction. There have been reports of anaphylactic reactions, allergic skin eruption, and fixed drug eruption. There have been reports of diarrhea, nausea, epigastric discomfort, and gastrointestinal bleeding occurring during. So, nursing consideration and your drug effectiveness. Avoid combining other drugs in the nebulizer to avoid the formation of precipitates and potential loss of effectiveness of either drug. Proper drug delivery. Dilute concentrate with sterile water for injection if buildup becomes a problem that could impede drug delivery. So that's all. Thank you for listening.